The U.S. COVID pandemic response has been plagued by a failure to adjust to emerging data and to account for unintended consequences. One glaring example of this is the handling of school closures, with the CDC guidelines continuously at odds with evidence from other countries and from school districts that opened in the U.S. in the fall of 2020. This disregard for data led to prolonged closures and a catastrophic decline in academic achievement and a widening equity gap. This was not the only area where our health agencies failed to acknowledge evidence. They also failed to recognize the protection against COVID afforded by natural immunity. Natural immunity refers to the immunological response that an individual develops after recovering from an infection. It is part of the adaptive immune response, which produces memory B and T cells that remain in the body and can quickly respond to the same pathogen if it's encountered again. For centuries, natural immunity has been recognized as a vital defense mechanism against reinfection long before the precise cellular mechanisms were understood. Throughout much of the pandemic, though, messaging in the U.S. was that there was no evidence of lasting protection from COVID infection. But in fact, we did know otherwise and early on. In July of 2020, a paper published in Nature showed a strong T-cell response in SARS-CoV-2 recovered patients. It also demonstrated that patients recovered from SARS, the first one, also had T cells that were still reactive to the virus nearly 20 years later, a very good indicator that SARS-CoV-2 immunity would be similarly durable. Several more papers came out in late 2020, early 2021, reaffirming these results and that even a mild or asymptomatic infection could produce a strong and long-lasting response. As expected, these immunological data translated into low reinfection rates. In February of 2021, a U.S. study of 3 million people showed a 0.3% reinfection rate compared to 3% in those without prior infection during the same time period. 2 months later, the large SIREN study of English healthcare workers estimated that prior infection was associated with an 84% lower risk of reinfection. By late 2021, there were numerous studies, including a systematic review, which showed that natural immunity was at least as effective as vaccine-conferred immunity and waned more slowly. The early data clearly showed that natural immunity was strong. Other countries did acknowledge this by allowing exemptions from mandates and passports, while the U.S. continued to disregard it. In the short term, this provided justification for mandates with no exceptions, an approach that resulted in staffing shortages, particularly in the healthcare sector, where we could least afford to lose workers. It also caused needless loss of life as vaccines were given to essential workers with natural immunity instead of being prioritized for the elderly. Additionally, the daily quarantine of thousands of students could have been significantly reduced if districts had at least made exceptions for students with natural immunity, at least. Disregarding the wealth of evidence of natural immunity led to missed opportunities to implement policies that could have been more effective and efficient in controlling the pandemic and limiting collateral damage. Unfortunately now, vaccination rates for other vaccines have declined, ironically increasing society's vulnerability to infectious outbreaks. While some of this may be due to missed medical appointments and school closures, there has also been a significant loss of trust in public health due to misleading messaging and inflexible policies during the pandemic. Our health agencies must learn from this unfortunate error of failing to be candid with the American public and for the pervasive implementation of policies that were not adequately supported by data. Thank you.